As you can imagine, imaging plays an important role in helping doctors evaluate and treat cardiovascular disease. It wasn't long ago that the only tools doctors could use to diagnose a cardiovascular condition were a stethoscope and a simple electrocardiogram. In the last 50 years, technological advancements in cardiovascular imaging have improved diagnosis and outcomes for patients. We wanted to know more about the kind of imaging that is used in today's cardiac care, so we contacted Jason Mulder, Nuclear Medicine Supervisor at AdventHealth Waterman, to explain some of the tests they use to help doctors diagnose and treat their patients.
Generally speaking, if your doctor sends you in or if you come into the hospital, you would probably have an EKG, okay, and that's basically just an electrocardiogram, which is going to show them the mechanical and the electrical function of your heart. If they see you have nothing wrong with your EKG, or if they do, they can also prescribe different types of studies to be done. If they do a regular echocardiogram and they see something unusual, they'll order a TEE, which is a transesophageal, so they actually pass a tube down your throat and they look at your heart from the back side. It gives them a better view of what's going on with the valves of the heart, with the walls of the heart and the septum of the heart. That's what the echocardiogram, regardless of which type, that's what it's designed to look at. So you're looking at valves, you're looking at the actual septum of the heart and the walls of the heart. The CTA is a very good study for the coronary arteries. It basically looks at the size, location, and make sure that there's no blockages. Nuclear medicine stress test does the same thing. Nuclear medicine stress test is very much like any other nuclear test where you get an injection of a tracer. That tracer takes up in the heart muscle, and then we image to see where that tracer goes. That image basically tells us if there's any blockages to the coronary arteries. So it's a diagnostic tool that the cardiologist can use prior to taking a patient to the cath lab. So we do these tests so that we can kind of see ahead of time as to whether or not they actually need a cath before they go to the cath lab. The equipment that we have here at Waterman is very advanced. The camera that you see behind you is a SPECT CT camera, so it has CT capability along with the nuclear capability. It's one of the most advanced machines that is out there, and they're able to do these studies in less than 10 minutes. So, and it's a very fast, very clear, very good pictures. The clarity of the images that you would receive are extremely important. You want to be able to see as much as possible. So it's the difference between seeing a blurry photograph of someone that you think you recognize and a perfectly clear photograph of someone you definitely know. The equipment itself allows us to more efficiently and more quickly diagnose patients. It allows us to be more certain of our outcomes and be more certain of what we're going to need to do for the patient.
To find out more about AdventHealth Waterman Imaging or their board-certified radiologist, please click the Advanced Cardiac Imaging story on our homepage at yourhometownhealth.com.